Hello and welcome. Today we're diving into a complex and often overlooked disease affecting the kidneys, renal vasculitis. Join us as we explore its causes, effects, diagnosis, and treatment. Renal vasculitis isn't caused by a single factor, but rather a group of conditions where inflammation targets the blood vessels in the kidneys. Many cases are related to systemic vasculitides, which are autoimmune diseases where the body's immune system mistakenly attacks its own blood vessels. These can include conditions like granulomatosis with polyangiitis, microscopic polyangiitis, and eosinophilic granulomatosis with polyangiitis. Certain infections, drug reactions, and even some cancers can also trigger renal vasculitis, though these are less common. Let's understand how renal vasculitis affects the kidneys. The inflammatory process damages the blood vessels, narrowing or even blocking them. This leads to reduced blood flow to the kidneys, causing tissue damage and impaired kidney function. The reduced blood flow causes ischemia, meaning lack of oxygen. Over time, this ischemia leads to scarring and eventual kidney failure if untreated. In many cases, the inflammation also directly damages the glomeruli, the filtering units of the kidney, leading to proteinuria, or protein in the urine, and hematuria, or blood in the urine. The exact prevalence of renal vasculitis is difficult to determine, as it's often underdiagnosed or misdiagnosed. However, it's considered a relatively rare condition. It affects people of all ages, but is more commonly diagnosed in adults between the ages of 40 and 60. Some types of systemic vasculitis with kidney involvement, such as granulomatosis with polyangiitis, have a higher prevalence in individuals of Northern European descent. The signs and symptoms of renal vasculitis can be varied and depend on the severity and extent of the disease. Early symptoms may be subtle and nonspecific, such as fatigue, fever, weight loss, and muscle aches. As the disease progresses, kidney-specific symptoms may appear, including swelling in the legs and ankles, high blood pressure, blood in the urine, foamy urine indicating protein loss, and decreased urine output. In severe cases, rapid kidney failure can occur, leading to the need for dialysis. Diagnosing renal vasculitis typically involves a combination of blood tests, urine tests, and imaging studies. Blood tests can reveal elevated inflammatory markers such as ESR and CRP, as well as abnormal kidney function. Urine tests can detect the presence of protein and blood. Imaging studies, like ultrasound or CT scans, can help visualize the kidneys and surrounding blood vessels. However, the gold standard for diagnosis is a kidney biopsy. This involves taking a small sample of kidney tissue and examining it under a microscope to identify the characteristic signs of vasculitis. Renal vasculitis is often classified based on the underlying systemic vasculitis that is causing it. The ANCA-associated vasculitides, including granulomatosis pos microscopic polyangiitis and eosinophilic granulomatosis with polyangiitis, are common types. Other classifications can be based on the size of the blood vessels affected, such as large vessel, medium vessel, or small vessel vasculitis. The primary goals of treatment are to control the inflammation and prevent further kidney damage. Treatment typically involves immunosuppressive medications, such as corticosteroids and cyclophosphamide or rituximab. These medications suppress the immune system and reduce inflammation. Plasma exchange, also known as plasmapheresis, may be used in severe cases to remove harmful antibodies from the blood. In cases of advanced kidney failure, dialysis or kidney transplantation may be necessary. Unfortunately, there's no definitive way to prevent renal vasculitis, as many cases are related to autoimmune conditions. However, early diagnosis and treatment of underlying systemic vasculitis can help prevent or minimize kidney involvement. Managing other risk factors, such as infections and drug reactions, may also play a role. The prognosis for renal vasculitis depends on the severity of the disease, the underlying cause, and the promptness of treatment. Early diagnosis and aggressive treatment can significantly improve outcomes and prevent progression to kidney failure. However, even with treatment, some patients may experience chronic kidney disease or require long-term dialysis. Recent research focuses on developing more targeted and less toxic therapies for vasculitis, as well as identifying biomarkers to predict disease progression and treatment response. Ongoing clinical trials are exploring the use of novel immunosuppressive agents and biological therapies to improve outcomes for patients with renal vasculitis.